You got New England pride, show us. You've got New England pride. Stand up, shout out, show us. You got New England pride, show us. You've got New England pride. New England pride.
Hi, I'm Dale LePage, and welcome to a special episode of New England Pride TV. We're going to do a two-part series on coping with anxiety. When I first mentioned that I'd be doing a show like this, your outpouring of support was just overwhelming, honestly. So this is a much-needed show. And when I asked you what questions you might like to ask a licensed therapist, you bombarded me with a lot of amazing questions, which we're going to be asking your questions that you gave me to our professionals today. So thank you for sending out your private messages to me, your text messages. One of you even called me. I don't know how you got my number, but please erase it. And one of you even stopped me on the street. So I knew we had something special here. I'm going to have my panel introduce themselves to you right now. We'll start with you, please.
Hi, my name is Nicole Daigle. I direct and counsel out of a small group private practice called Serenity Coaching and Counseling in Worcester.
Thank you.
Hi, I'm Liz Green. I'm a mental health therapist, also through Serenity Coaching and Counseling.
Perfect.
Hi, I'm Elizabeth Plant, and I'm the DBT specialist at Open Sky Community Services and clinician at the Bridge Counseling Center.
Thank you.
Mm-hmm.
I am Jack Benina, and I'm a private practice therapist in Worcester at 74 Elm Street. I'm also director of outpatient counseling, substance abuse counseling at Community Health Link in Worcester.
Wonderful. Thank you so much for being here with us today. So, like I mentioned before, these are all questions that were sent in to our viewers of New England Pride TV, our friends on Facebook. We're going to start with this side of the room, please. One of the questions was, what is the ratio of men to women who suffer from panic attacks and anxiety seeking help?
Well, what I know is that research has demonstrated that women are twice as likely to suffer with depression or anxiety in general.
Really?
Yeah, so and then in recent studies I've looked at female versus male seeking treatment. Usually relatively, I think females was around 30% and then males were just under 20. So there is a 10% difference. I also know that of the people who suffer from anxiety, from what I've been able to research myself through the National Institute on Health, about 40% of people are being treated. So that's 60% of the population that aren't seeking treatment. Within my own private practice, when I was looking at those numbers, when you gave me those questions, right, I in fact saw that about 68% is a female to male ratio in the practice. And those seeking treatment for anxiety is usually 2 to 1.
Wow.
Female versus male.
Now, can you tell me and our viewers, please, in your opinion, what is the difference between general anxiety and panic attacks?
So general anxiety and panic is separate, but it's almost the way you want to think about it is like on a range. Okay. So everybody has anxiety to some degree. Without anxiety, we wouldn't, I always joke around, we'd play in traffic. So basically, the way when it becomes diagnosable, it's almost like over this line where certain symptoms become too intense. So on the lower degree, you have your general anxiety. On the higher degree, you have your more intense symptoms like panic. And that's where panic attacks can come in more readily.
Thank you so much. Jack, I have a question for you. How effective has homeopathic medicine been in your treatments?
Well, I think when we think of homeopathic medicine, it's non-prescription type medicine prescribed by a doctor. People have been using remedies for hundreds of years,
right, yes.
Roots and herbs and all of that.
Right.
So I think, there is certain benefits to homeopathic medicines or supplements. I think commonly people will use things like, for example, teas, or lavender, aromatherapy.
Right.
Things like that help a lot. In terms of some of the effectiveness of the other over-the-counter type of remedies, I think people have to use some caution in that because, much of the home remedy market is not really researched. It's a lot of
I have heard that.
anecdotal
Yes,
kind of
yes.
things. So, I've known people who've taken things like kratom, which is, I think it's called kratom. It's very addictive, but it's over the counter.
I'll have to look that up. I'm
Yeah,
not sure what
and
that is.
it is a sedative type of thing.
Oh,
So,
okay.
so you have to be careful about that, and I wouldn't want to promote any one thing, not knowing the specific research on it. But there is a place for like aromatherapy and some of the teas and things like that.
It's nice to know that it makes some kind of difference.
Yeah.
Elizabeth, my question to you is, how do I meet, this was sent to me by a woman with agoraphobia. How do I meet new people and not be anxious to be in a group setting or social events? We all have social anxiety. Are there certain things that you can recommend?
Yeah, well, I think meeting new people is really challenging, especially the older you get. And I think it's hard because you do have to put yourself out there. It kind of requires getting out there. And so this might mean joining a group or just talking to people that are in the places that you like to be. I think finding people who share similar interests as you, so maybe people who have the same political leanings or values or lifestyles can make conversations happen easier. So working on conversation skills can be really important. Learning how to make small talk, even though that can be really anxiety provoking, like how to start a conversation. Talking about hobbies and interests. Pets is a really awesome place to start. I think everyone loves talking about their pets.
So not politics or religion.
Yeah, well, it could be politics or religion. Me, I talk about my cats and my dog. I think just your willingness to put yourself out there repeatedly despite anxiety will really start to train your brain that it's not a dangerous situation, that you can get through it.
Right.
Yeah.
That's wonderful
Yeah.
advice. Now, Nicole, does anxiety automatically mean panic attacks are to come?
No, the difference between that I equate anxiety to be is that low grade to excessive worry that we all have on some level, like Liz was talking about earlier. And that for most people, we all have that anxiety. It's when that anxiety, it can turn into a full-fledged panic attack. I'm anxious about going to this party and meeting new people versus now I'm at this party and I'm having a panic attack. And that panic attack is generally our fight, flight, or freeze response.
Yes.
It's those 10 to 20 short bursts of extreme discomfort. That's when someone's saying, I'm having a heart attack, and they're showing up in the ER, and now all of a sudden they're sitting in the ER for 15 minutes, they're like, oh, I'm feeling better. And sometimes that's that panic attack.
I just learned something new. You said fight, flight, or freeze.
Correct.
My viewers know and my friends know that I was off the stage and basically not doing what I love doing, which is performing, for 25 years because of panic attacks. And I was the fight or flight. I was the flight. I didn't know there was a freeze. So
Yeah.
thank you for that. Now, Liz, my question to you is, what are some of the varying degrees of social anxiety? There must be varying degrees.
So it really depends on the person's kind of manifestation of their symptoms.
Okay.
So, you have some people who their social anxiety may be more where they associate certain situations or circumstances with certain, their symptoms attached themselves to that. Other people, it can be more general than that. It can be more of worrying about, a lot of times what I hear and is more frequent is like worrying about, well, what is people going to think about me? What are they going to say? So more of this kind of like cognitive thinking kind of preemptively about what's going to happen in a setting. And it could be in a setting that they know. It doesn't necessarily always mean settings you don't know. And so it really depends on that, and then the physical symptoms that can go along with it. Some people can have very different physical symptoms than others. So like with anxiety, and especially if they get more into panic, it could be heart palpitations, muscle tension, racing thoughts, heart, just kind of like sweaty palms, things along those lines. So it's really getting to know yourself and what that means, knowing the different symptoms that can occur, and then picking out the ones that like make sense that you are experiencing.
Love it. Thank you so much.
Yeah.
Now, Jack, One of the questions from our viewers is, do you think technology has played a part in the increased number of anxiety sufferers? That's a whole show on its own, right?
Yeah, right. Yeah. I think, if you think about some of the theatrics that go on Facebook,
Yes,
that's bound to cause a lot of anxiety.
Yep.
So social media is part of that technology thing that can cause a lot of conflicts and issues and fears, and not feeling like you're fit in with your peer group, for example, or things like that can cause a lot of anxiety. The other idea that technology is a great thing, but it makes us work a lot harder. We have access to a lot more information, and
we're constantly bombarded.
Being bombarded, so it can cause a lot of stress. Especially if you don't know how to use the system or something.
True.
It can be very stressful, and I think that more.
WebMD.
What is that?
Or we use WebMD.
Yeah, let's not use WebMD for anything, because it's always cancer or a brain tumor.
Right. It's a lot of things like that. So even though we have access to all this information, it can be overwhelming, it can be confusing, that can cause anxiety. So, I think we have to also think about the isolation that technology can cause. Kids will spend too much time on their phone, not living their life,
That's where I was hoping you were going to be going with this, but I think that's really important.
Yeah, it really, I think in terms of social anxiety, it's a good way to hide,
It is a good way to hide,
and the best way to overcome social anxiety is to be out there, like you were saying, experiencing new things. So
absolutely.
Yeah, so technology has got its two sides to that.
Yes, it absolutely does. It absolutely does. Elizabeth, this question was posed by a woman who has severe childhood trauma. Her question is anxiety caused by childhood trauma ever curable, or does one consider it a lifelong and just maybe manageable?
Yes, it's absolutely curable. So, when folks experience childhood trauma, it leads to a number of symptoms of anxiety. Sometimes they resolve on their own, and other times they don't. And so there are a couple treatments that I practice that have really helped people of all ages that have struggled with childhood trauma. One is called cognitive restructuring for post-traumatic stress disorder, and that really involves taking a look at the way in which you think about yourself, other people in the world, that is kind of based on your trauma. Because when you go through a traumatic event, things feel dangerous and things feel unsafe, and then you're walking around in the world experiencing things that remind you of that but aren't necessarily dangerous. So this treatment really takes a look at looking at the common but unhelpful ways that you think about these things, and kind of looking at the evidence that those things might be accurate or not, and then trying to come up with a more helpful way of thinking about the situation. The other treatment that I do is a little bit more well-known. It's prolonged exposure for post-traumatic stress disorder. And this is really digging in deep into your trauma memory, repeating it over and over in session to habituate yourself to that memory and to take control away from the memory, so that you're not necessarily pairing the memory with the trauma, because your memory of the trauma is not dangerous. The trauma was unsafe, but thinking about it isn't. And so doing that repeatedly, while also between sessions going out into the world and doing things that you've avoided doing because of your trauma, things that aren't unsafe, and learning that you can cope with it and that you can get through it. So people at the end of these treatments find that they can go out and do things they haven't done in ages, And so I've recently experienced, I have a woman that just finished prolonged exposure, 55 years old, and is doing amazingly. So it's definitely possible.
That's a very hopeful answer. Thank you.
Yeah, sure.
All right, we're going to take a break. We'll be right back.
New England Pride TV is presented by Fallon Health and sponsored by the Hanover Theater for the Performing Arts, Remax Vision, Bay State Savings Bank, Safe Homes, The Pavilion at the Beer Garden, Paul Chasen Interior Design, Nuovo Restaurant, Dr. Frank P. Fechner Plastic Surgery, The Queen's Cups, Healing Point Therapeutics, Art Reach, Electric Haze, Bull Mansion, Ellie's Pet Barn, Handmade Taekwondo Center, Root and Press Cafe and Bookstore, and Herd, Strategy and Storytelling.
Welcome back to our anxiety special here on New England Pride TV. My next question comes to you, Nicole. What are some of your preferred methods of treatment for anxiety?
So I'm a cognitive behavioral therapist at heart, so I really believe that by changing your perception of that anxiety or your cognitive connection to that, it will help change your behaviors connected to that. With that, I also work on a lot of grounding and mindfulness techniques. And then with each client, we all have different resiliencies. So if you're a runner and you're able to get to that point where you can hit that runner's high and let go of all that anxiety, that's great. I'm always going to reinforce that and start off from there. But initially, when I first meet with clients, it's really getting them grounded in today, where are you at, what are you worried about, and then I start to really break down, when did you start thinking about this, how long have you felt like this before, and sometimes I have to go way back in history, because that thought started like when you were a teenager, and then we built onto it.
Interesting.
So if you had like a teacher who told you you're not good at math when you were young, now every time you've approached that math problem, you're like, oh, I'm just not good at it, so why even try? So sometimes I have to go way back and say, who told you that, and why did you listen to that?
Right.
Does that make sense?
That's a great answer. Thank you so much.
You're welcome.
My question to you is going to be, one of our viewers wrote in and said, what are your views on exposure therapy? I didn't know what exposure therapy was.
Yeah, so exposure therapy, like kind of playing off what Elizabeth was saying, is kind of like where you kind of really look at kind of those fears and what is causing that anxiety, and you really actually, instead of try to avoid it, you try to embrace it. And there's some of that can be done, whether it's just through talk, so you could do light, or some practices do more heavy, where they actually take you out somewhere and they do something. Okay. I don't do that as much, more through talk. I also do, which is kind of exposure therapy, it's called cognitive processing therapy. It's more so around trauma, as you were talking, Elizabeth, where it kind of combines cognitive behavioral therapy with kind of exposure, but in a way that doesn't, because especially with trauma, a lot of the symptoms are trying to avoid dealing and thinking about the trauma. So really tries to get people to look at it without actually looking at the trauma. And it's really looking at how it affects you now, and then change those kinds of ideas or rules or things that were created from that, and change that up and see how they work or don't work, and then kind of go from there.
Wonderful. Thank you so much. Jack, I'm going to turn to you now. I think this is a very good question regarding family or friends. The question is, how do you talk with someone you love about anxiety who does not suffer from it, who just doesn't get it because they've never had it or experienced it?
Well, that's something that's really causes a lot of conflict sometimes.
It can,
when people don't understand what you're feeling, what you're thinking. So I think that one of the things I would recommend is to be patient and be a good listener. I think it's we often don't experience the same things other people do. So we have to really try to empathize and try to put yourself into the shoes of the other person, and the person explaining it, to try to give as many details about what situations cause anxiety.
Very good, yes.
What kind of situations might be helpful to get a little bit extra support around, from their partner or their loved one.
Now, my next question is going to be for you, Elizabeth. One of our viewers writes in, why would anxiety start in someone's 50s when they've never had any signs of it before? I think that's an interesting question.
I think we all have anxiety, no matter what our age. I think, as we talked about a little earlier, anxiety is that kind of inborn natural fight, flight, or freeze response. When we're faced with a situation that we feel is dangerous, whether it really is or is just perceived, we either prepare to attack, or we prepare to run away, or that freeze is like, I need to hide, I need to hide to protect myself. And so, any kind of situation that presents itself in that way will bring up feelings of anxiety. with someone that's in their 50s that maybe never noticed anxiety before, it might just be that that instinct has intensified. You know, that response has intensified to the point where it might start affecting work, or it might start affecting, you know, your ability to take care of your family. And so, you know, when you notice that those things are happening, no matter what your age, that's a really good sign to reach out for support from someone that you trust or a professional.
Thank you. That
Yeah,
was
sure.
well said.
Do you think hormonal changes would affect any of that?
Absolutely.
Also? Especially in your 50s, if
Absolutely.
you're a woman?
I think as you age and your body changes and your hormones are changing, that's a really good point, that there can be shifts in the way you experience your moods.
Next question to you. Do you, this is your personal opinion here,
Sure.
do you offer support groups to all of the family of people who are suffering from anxiety and panic attacks? How important do you think that is for the entire family to be involved in some kind of therapy?
I think it's very important. So a lot of the foundation of the work that I do is very couples and family based. At Serenity, we offer weekly workshops that are stress reduction and mindfulness workshops. So it's a lot of grounding techniques, which can keep you teaching you skills. And then we also do a lot of DBT and CBT workshops. And then I myself run a monthly seminar. And in that format, I talk a lot about behavioral couples therapy and family therapy, how you can communicate better, how you can listen and understand each other better. And then I also let anyone who attends that seminar ask me any question. And then it really can be personalized through that, which is great.
That's wonderful. Do you have families come in as a unit?
Yep.
That's nice. Now, Liz, my question to you is, and this is something I wanted to bring up from the beginning. And what is your ratio of children suffering from this? Do you see a lot of children being affected in this?
So there is about a quarter of 13 to 18-year-olds that suffer from some form of anxiety. Now, the thing with children is that it can come out in different forms than adults, and so we have to be aware. A lot of times there could be irritability instead of kind of some of the typical kind of symptoms that we talk about, because kids sometimes are trying to figure out how to communicate what's going on with them.
Right, that never occurred to me. That's
right,
so smart.
right. Yeah. So a lot of times it's now our practice has a small ratio of children that we practice with. It's mainly children, adolescents, 13 to 18. I have a couple of high school age adolescents myself, and it's generally trying to get them to especially that age range. It's very important for psychoeducation, that these kids are asking questions about what is anxiety, what are emotions, what is it I'm feeling, especially at that very important where they're developing and starting to understand their emotions in their adolescence.
Right. Now, just a quick follow-up to this. With the adolescents that you are seeing, are you finding that their communication skills are need to be worked on also?
It can be, because it depends on, now some of them are very, I mean, I have an amazing young woman that she is just so articulate about like what's going on for her. So she has more of like what we would say like the general anxiety, but someone like that has where we're talking about like the social anxiety, they might be struggling more with the communication piece. And so that's where sometimes it's like the treatment that is kind of centered around it is helping them put the words to it, helping them identify it so that they can really understand and communicate what's going on for them and kind of be able to go from there. Beautiful. A lot of times that's the trouble.
Thank you so much. Very well said.
Thanks.
Jack, we're going to turn to you now. This is a question that I actually experienced. My husband will not take his anti-anxiety medication that was prescribed to him because he thinks of it as a weakness. How do I get him to understand that needing medication is not a weakness? Now, I'm just saying that, posing this question because I was prescribed medication, just lorazepam. But for a long time, I am taking it, doc. But for a long time, I thought of it like as such a weakness, like in me.
Well, I think as men we're socialized sometimes in that way, you know, that we have to take care of it ourselves. We have to do it ourselves, you know.
Yeah.
And that is definitely unfortunate because a lot of men, you know, end up, or people in general, when they think like this, they end up really causing more problems for themselves.
Absolutely.
You know, so, you know, I think it's important that not just with anxiety, but within mental health issues in general, there's the stigma that people have around
it is a stigma,
mental health.
yes,
Yeah.
yeah.
And it's quite human, you know. If you break down the statistics,
Right.
like all of us struggle at some point with something.
Absolutely.
You know, and
Yeah.
I think we have to think of this also as oftentimes a physical, biological kind of thing as well. And you know, it's important for you know, if we had a physical problem, we would go to the doctor.
Right.
You know, what we're finding out about mental health issues is that they often are physically, you know, genetically kind of brain structure kind of changes that are happening in our bodies. And
I think that stigma
Yeah.
needs to be just blown apart.
yeah, it's really unfortunate.
Elizabeth,
Yeah.
now your question that's being posed to you is, have you seen success in managing anxieties without drugs?
I definitely have, absolutely. And so, you know, in addition to the treatments I mentioned earlier for trauma, you know, as you are, I'm a cognitive behavioral therapist, you know, by trade, and I've seen a lot of success. It's a treatment that is backed by research and evidence, and it's the type of treatment, as mentioned, that really takes a look at the connection between the way you think, the way you behave, and the way you feel. And so if you make an impact on any one of those three areas, it's going to directly impact the other two. I will say I also have seen great success with that in combination with medication. So again, I don't think there should be a stigma about medication if that is, you know, what you're doing in addition to talk therapy. But I think there are a lot of really great evidence-based treatments for anxiety that don't require medication as, you know, a component of the treatment. Absolutely.
Thank you. We're winding down. We just have one more quick question. I'm going to ask everyone on the panel here, and perhaps you can help me and my viewers. Are there any particular, like, would you recommend some of your patients or clients read any books or anything on the subject, or do you go through like worksheets with them, things like that? Does any of that happen in your practice?
I mean, without swearing, there's a book out there right now, The Subtle Art of Not Giving a...
Oh, really?
Correct.
Okay.
And I've had a lot of my clients come in and be like, especially men, saying, I've read this book and it's changed my perception on how I view this event or how I want to approach this. What do I need to worry about, essentially?
Have you read the book yourself?
No,
Okay.
not yet.
Okay, but you've had people who've liked the
Correct.
book?
Yes.
Okay.
But I usually say whatever empowers you or connects or you can see something in a different way, I'm going to reinforce that.
Right.
All I can give you is the knowledge I have, and if you want to supplement that by either...
Right.
I mean, that's what's great about a lot of those different books.
Wonderful.
And there's so many out there, I mean.
Yeah, I would direct people to the National Institute on Mental Health.
Yeah.
Which is part of the National Institute on Health. And there's a lot of information that people, including other resources listed there, as well as explanation and understanding of what causes anxiety and other issues.
Thank you so much. Do you?
I was going to say, I think too, for those that want to do a little work on their own, the anxiety and worry workbook is really great, as well as Feeling Good, the New Mood Therapy, and those can both be found on Amazon for like really cheap used.
All right, it's a good workbook. That's it for this episode of New England Pride TV. Tune in next month for our second part of Coping with Anxiety. Thanks for watching.
Tune in, show us you got New England pride. Show us you've got New England pride. Stand up, shout out, show us you got New England pride. Show us you've got New England pride. New England pride.